Hello and welcome to week 2 of PUBH 610. Today we will review the delivery of healthcare in the United States. The learning objectives for this week are to understand the U.S. healthcare system, to outline the key components of a healthcare delivery system, to discuss and describe characteristics of the healthcare system in the United States and how it differs from other healthcare systems, and to introduce the systems model as a framework. The U.S. has a unique healthcare delivery system. While we have some of the best clinical care in the world, at the population level, we fail to deliver equitable services to all Americans. Even though the U.S. consumes more healthcare services as a proportion of its total economic output than any other country in the world, many Americans still do not have health insurance. And a true healthcare system that works together does not exist in our country. Our healthcare system is massive, employing over 16 million people, but it is also very fragmented, and it continues to change. Health policy is a political hot topic. Whether you're hoping to repeal and replace the Affordable Care Act or lobbying for Medicare for all, most people are dissatisfied with the healthcare system in the United States and want some type of change. Because our healthcare system is so fragmented with so many different stakeholders and interests, cost containment is very difficult. This has led to the U.S. spending more than any other country on healthcare, yet failing to see gains in population health. As you'll see in this graph, the U.S. spends more than twice the average of other developed countries on healthcare spending and almost 3 times the OECD average. When you look at healthcare spending as a percentage of GDP, the U.S. remains an outlier. This graph, which shows healthcare spending as a percentage of GDP from 1980 to 2013, shows that in the 1980s, the U.S. was spending a similar percentage of GDP on healthcare as compared to other countries, but over time has increased dramatically while other countries have only slightly increased their healthcare spending. I want to remind you that GDP stands for Gross Domestic Product, and it is the total market value of the goods and services produced by a nation's economy in a specified period of time. And you can click the link to listen to an interesting article about what GDP is and why some people are arguing that it is no longer the best measurement of an economy. GDP is good at capturing quantity, but not good at capturing the quality or inequality of healthcare in a nation. An acceptable healthcare delivery system should have 2 primary objectives. 1, to enable all citizens to obtain needed services, and 2, to ensure cost-effective services meet quality standards. Unfortunately, the U.S. is failing on both fronts. However, the U.S. does lead the world in medical technology, medical training, research, and we have very sophisticated institutions, products, and processes. As we move through the semester, we will continue to come back to these 3 key aspects of healthcare: access, cost, and quality. There is a widespread sense of urgency among employers, insurers, consumer groups, and other policymakers about the seemingly unresolvable problems of inadequate access, rising costs, and the questionable quality of healthcare in the United States. Most Americans are privately insured through employer-based health insurance. An employer purchases insurance through a managed care organization or insurance company for their employees and offers this as a fringe benefit of employment. Typically, employers pay a large portion of the health insurance premium and the employees pay a smaller portion. This is called premium cost sharing. People who don't have employer-sponsored coverage or who are self-employed have to get health insurance on their own, which is much more expensive. A small but growing number of Americans purchase health insurance privately post the Affordable Care Act through health insurance exchanges. The government finances health care for the elderly, those over the age of 65, and people with certain disabilities through Medicare, and for low-income Americans and children through Medicaid. An easy way to remember the difference is that we care for the elderly, but we aid the poor. Another important distinction between these programs is that Medicare is a federal policy, which is the same across the country, while Medicaid is jointly administered by the federal government and the states, and therefore each state has a unique Medicaid program with different services and eligibility requirements. This graph from the U.S. Census shows the percentage of people by type of health insurance coverage and the changes from 2013 to 2017 post the Affordable Care Act. While the number of uninsured has decreased overall since 2013, from 2016 to 2017, the number of uninsured slightly increased. And it's important to remember that most of the uninsured are not unemployed. They just work low-wage and/or part-time jobs and cannot afford insurance and aren't eligible for any public benefits. Healthcare reform refers to the expansion of health insurance to cover the uninsured in the U.S. The Patient Protection and Affordable Care Act, also known as Obamacare or the ACA, was passed in 2010 and was the most sweeping healthcare reform in recent U.S. history. One of the main goals of the ACA was to reduce the number of uninsured, which was accomplished through several provisions, such as allowing young adults to stay on their parents' insurance plans till the age of 26, and the individual mandate, which required all U.S. citizens to have some form of health insurance or face a penalty. The individual mandate was overturned by President Trump, and now individual states, such as New Jersey, are implementing their own statewide mandates and tax penalties. By 2016, 20 million Americans had gained insurance coverage through the ACA. However, despite progress in 2016, 27.3 million Americans remained uninsured. Here are a list of some of the external influences that shape the healthcare system in the United States. Which of these factors do you think is currently making the biggest impact on our healthcare system? Is it our divided political climate, our aging population and decreasing fertility rates, or is it technological progress, which is making telemedicine and virtual interactions with medical and mental health providers more accessible? There are no right or wrong answers to this question, but it is certainly worth considering. Here is a list of 10 basic characteristics that differentiate the healthcare system in the United States from those in other countries. And we're going to walk through each of these. First, there is no central agency. Most other developed nations have a national healthcare system with a defined set of healthcare services all citizens are entitled to receive. To control costs, these systems use a global budget, which determines the total healthcare expenditures on a national scale and allocates resources within the limits of the budget. Therefore, the availability of services and payments to providers are limited. These governments also control the use and abuse of costly medical technology to avoid someone receiving something like a CAT scan for a tension headache. But in the U.S., we do not have a central agency providing this type of oversight and regulating costs. Instead, we have a private system, predominantly financed through employers and the government. Because the majority of hospitals and doctors are private in the U.S., no one is monitoring their total expenditures and their service utilization. No one monitors total expenses through global budget in the United States. However, the government does set public sector expenses and reimbursement rates for Medicare, Medicaid, and CHIP, as they are federally run programs. The government also sets standards of participation for these programs. Providers must comply with standards to be certified to provide care for Medicaid and Medicare patients. These standards are regarded as minimum standards of quality in most sectors of healthcare industry. Because Medicare is such a large public program, providing care for 60 million older adults and people with disabilities, and it accounts for 15% of total federal spending in 2017, Medicare is a trendsetter, and often what Medicare implements is soon followed by private insurers. One example of this is the use of diagnostic-related groups as a cost containment mechanism. We will discuss this more next week. Second is partial access. Health insurance helps ensure access, but it does not guarantee it. Some people may have health insurance but still be unable to access needed health services due to high out-of-pocket costs and deductibles. As we previously discussed, Americans can access healthcare services through their employer, under a government healthcare program, by buying insurance using their private funds, or by paying for services privately. They can also obtain care through charity or subsidized care. Under U.S. law, hospital emergency departments are required to provide medically needed services for which the hospital does not get paid. Therefore, the uninsured in America can obtain acute care in emergencies, but they often are forced to avoid routine care, which would enable providers to prevent disease in the first place. Universal health coverage is a global priority and has been recently highlighted by the World Health Organization. However, it is important to recognize that even countries which provide universal health coverage do not necessarily have universal access. No health system has the ability to provide every type of health service on demand. In order for the principles of a free market to work, many conditions must be met. The patients and the providers must act independently. Providers do not collude to fix prices, and prices are set by the interaction of supply and demand, not by external agencies such as the government. Also, in a free market, the quantity of services will increase as the price is lowered and vice versa. Also, an equilibrium is achieved without interference. However, the U.S. healthcare market doesn't meet the conditions of a free market, so this does not occur. Unrestrained competition is also violated because in certain parts of the country, a single medical system dominates, therefore limiting competition. Asymmetry of information is another reason the healthcare market is imperfect. Providers know more about new diagnostic tools and treatments than patients do, and sometimes patients are unconscious when they need these services. Another aspect is that because of health insurance, patients don't bear the full cost of services received. This may lead to moral hazard, which means that once people have insurance, they use more healthcare services than they would if they had to pay for it out of pocket. Unlike most other health systems, in the U.S., insurers act as an intermediary between patients, those who finance and deliver care. Insurers don't have any real incentive to advocate for patients, to lower price or improve quality. And at the best, employees can try to lobby their employers to change their healthcare provider or plan if they're dissatisfied with their employer-based coverage. The United States has multiple payers. A single payer system is one in which there is one primary payer, typically the government. An example of this is the UK, where providers bill and are paid by the government. In the US, we have many different payers and plans, which makes billing and collection difficult. It is generally believed that the US spends more on administrative costs associated with billing, collections, debts, etc., than do other countries which have a national healthcare system. In such a fragmented healthcare system with so many stakeholders, it is difficult to balance power among competing interest groups. For example, the government wants to control Medicare costs, but physicians want to be reimbursed more for their services. The U.S. is unique in that we are quick to file lawsuits in hopes of getting money. As a result, physicians have to protect themselves against the possibility of being sued and purchase malpractice insurance. They also have to engage in defensive medicine, such as ordering excessive tests to avoid malpractice. These additional tests and checkups may be unnecessary and contribute to the high healthcare costs in the United States. People think that the latest technology is the best, especially when health insurance will pay for the services. Hospitals also want to possess the latest technology and be seen as modern and cutting edge. However, once an investment in a new high-tech service is made, these costs must be recouped by having people use them. And this overuse can drive up the cost of healthcare in the United States. Healthcare services are a continuum of services, and they can be provided in many different settings. They can be curative, such as prescriptive drugs, surgeries, and treatments, restorative, such as occupational and speech therapy, or preventative, such as vaccines and screening tests. Healthcare can be provided in numerous settings, such as outpatient clinics, at home with home health aides, in surgery centers, and nursing homes. In the U.S., the healthcare continuum is very lopsided, with more emphasis on specialized services rather than on preventative care and management of chronic conditions. Quality of healthcare is difficult to define and measure. However, we are increasingly working to define quality and link payment for services to value rather than the quantity of services being provided. Healthcare providers must meet quality standards in order to receive payment in new reimbursement structures. And we'll discuss changing legislation such as MACRA and how we're trying to improve quality of healthcare through those legislation next week. Continuous quality improvement is a tool used to monitor and manage quality in healthcare institutions. This is also something that we'll discuss in greater detail during week 7. The U.S. healthcare delivery system continues to undergo fundamental shifts. We are increasingly focused on changing from illness to wellness and promoting health while reducing costs. We are trying to provide more effective and efficient quality care and focused more on the delivery of services. And we're increasingly looking to mid-level health professionals such as health coaches, nurse practitioners, and the use of health information technology to improve services. Even though the U.S. healthcare system is fragmented and dysfunctional at times, it is a system, and therefore a systems framework is needed to analyze it. Systems foundations include the historical, cultural, social, and economic factors which led to the current healthcare structure. We will discuss the evolution of the healthcare system in greater detail next week. System resources for healthcare include human resources, nurses, doctors, etc., as well as non-human resources such as diagnostic tests, drugs, and hospital beds. System processes govern the care that patients receive in health settings, such as inpatient or outpatient environments. For instance, in what order patients are triaged and seen in an emergency room is a process. Systems outcomes are evaluated by the 3 pillars of health policy: access, cost, and quality. Lastly, a healthcare system must be forward-looking and anticipate desired systems outcomes in the anticipated social, economic, and political environments in the future. In summary, the U.S. has a complicated healthcare delivery system, which provides high-quality individual care to wealthy Americans, but fails to provide universal health coverage and is lagging on many population health measures, such as infant and maternal mortality. The U.S. healthcare system is not governed by the free market, nor is it controlled by the government as it is in most other developed countries. This lack of control has led to high costs and poor outcomes, and it's important for healthcare providers and managers to understand how the healthcare system works and its dysfunctions in order to work together to improve healthcare delivery in the United States.